Hi everyone, good afternoon. My name is Moses Do Agbasin, master student of Valparaiso University offering public health epidemiology. In today's presentation, I'll be presenting on a topic prevalence or prevention of enteric infection in children under 5 years in Ashama municipality. And I'll be taking you through the introduction, why this topic. We'll look at the demography and socioeconomic characteristics. We'll also look at the health problem of the community. We'll look at the existing program and how we'll assess the program, use the SWOT analysis, and my proposed program using the logic model, the budget, recommendation, and conclusion. So by way of introduction, enteric infection is one of the major cause of morbidity and mortality among children under 5 years in Ashama municipality, including sub-Saharan Africa. And due to overcrowding, limited sanitation, and unsafe water expose children to continuous fecal contamination. Despite the National Integrated Management Child Illness Program in the community, the community or enteric infection still remain high in this community. And as a result of the enteric infection, symptoms such as diarrhea, vomiting, abdominal cramp, and dehydration present itself in the or are some of the complications or the symptoms that are seen in these children. And also urban informal settlements such as Ashama has been a burden due to infrastructure challenges. And so you can see clearly in this picture how poor hygiene, unsafe water is exposed this adult to use the open defecation method. And you can see the children also around the dumpy site where the water is flowing or the gutter is there, see the water which enter into the stream, and as a result cross contamination begins over there. So like I've mentioned, the area is densely, so you can see in the picture how cloudy this community look like. And the target population, as I mentioned earlier on, is children under 5 years in Ashama municipality. And the demography, the population, I said, is densely populated, which has about 280,000 people according to 2021 census. I said low income settlement with mixed formal and informal education is what the community is made up. So you can see in the map of Ashama how big the community is. And you see some of their profile, like we said, due to the densely populated and the lack of safety or safe water or potable water, they tend out to do standby pipe, which means that you need to go and queue for you to get a potable water to use at home. And they have limited what household tap. That's why they have to use the public one, and they also have limited toilet facilities, so they share the public one. You need to go and queue. If you cannot wait, then you have to use the open defecation method, which the people practice. So you can see in the picture how everything is distributed over there. So the health challenge over there that mostly they present to the hospital at the OPD level, malaria. And we know malaria is caused as a result of what? Mosquito by falciparum in Africa or Ghana, for instance. Falciparum is the parasite mostly that affect the people. So due to the stagnant of water, it become a breeding house. Even cholera as a result flies here and there. So this is a typically health challenge for this community, and you and I need to help them. And they have existing program, which is what the existing program is community health volunteers which provide home visit. You can see in the picture how these community volunteers come together to clear the gutters. See how they are washing the windows over there in order to tide up their houses or make sure the community look more attractive. So the program is assess, use the SWOT analysis, looking at the strength, the weakness, the opportunity, and the threat. So by way of strength, which means that he had a functioning community health volunteers network already, which is helping on the ground, in the ground, and the weakness is that there's poor community level prevalence data, and opportunity is due to what integrated household was assessment, and there is high what population density as a threat to the program. And this program is assessed using my proposed what logic model. So the goal is to reduce the enteric infection by 50% in 1 year. And the approach that I want to use is to improve latrine access. Hand washing facilities will be provided and safe water supply for the community so that they will be able to practice hygiene. In order to do that, I use the logic model uh, to assess the program, or the logic model for my program. So we look at the input, we look at the activity, the output, uh, outcome, and the impact. For instance, when we look at the laboratory resources, they will be doing the water testing and stool testing, and children will be screened, early detection among children. Then there will be a reduction in morbidity. And also, what will happen is that the community sanitation will improve, and the household water treatment will also improve using what the laboratory techniques, using all the stakeholders coming together, and the policy that will enforce or will strengthen this program. So in order to achieve this program, you need money, you need capital, so that you can be able to fund the program. Therefore, the total money or amount that I'll need is 414,500 Ghana cedis, which is equivalent to 36,934 USD dollars. So the recommendation is that my recommendation is that expand, we should or vaccination should be expanded, which should include typhoid immunization. And also we need the NGO to partner with us so that at the end we will be able to achieve our goal. So the evidence is that WASH in program, which is water sanitation and hygiene intervention, will reduce diarrhea disease up to 50%. Like I said, that is my target. An integrated program will also help in order to achieve this goal. In conclusion, enteric infection remain major health threat for children in Ashama municipality, and if we implement our program well, bringing on the stakeholders such as the Ashama Municipality Health Directorate, the Environmental Health Protection, then the District Directorate, if we bring all of them together, we'll be able to achieve our goal. Thank you so much. So you can use these references to assess my work. If you have any question, you have allowed, or the floor is open for you to ask.